If a patient has not had an annual physical in a number of years, and yet they feel great, they don't have any bad medical history problems, anything like that, do they still need to get this annual checkup?
Most definitely. I mean, at the end of the day, the insurance companies, they want you to be healthy. They want you to be as well as possible. And part of that motivation as far as no out-of-pocket expenses for getting that annual wellness is pretty much contributed to this, because the healthier you are, the better for them and everybody. So what the insurance companies understand, and we as medical providers understand, and what I'm explaining to you all is any medical condition, 99.9% of the time, if you diagnose it early, especially before you develop symptoms by getting your annual wellness exam, you identify it, you treat it, in most cases, the outcome is 100% better.
Dr. Quinn, I imagine you probably have had some examples of somebody who maybe you caught something at one of these wellness exams that they didn't even know they had.
Oh, most definitely. I mean, I could just give you hundreds of examples, but one example I really wanted to cite was a patient that came to see me a few years ago. I'll never forget this lady. She was so sweet. Basically, she came in because she had like a little rash, and I noticed that she was eligible for a wellness exam with her health insurance. And I asked her, I said, is it okay if we do it? And she said, I don't need a health exam. I feel good. I'm healthy. She was 42 years old, no problems. I said, but hey, if you get that health exam, there's no out-of-pocket expense. And plus, it's a really good idea. So she agreed to do the exam. And as a doctor, I'm always going to try to get that wellness because that's my job. Mm-hmm. The deal is she blood pressure was good. Diabetes, none at all. Cholesterol was low. Everything was great. I did a breast exam, didn't even feel anything. But I told her we have to get that mammogram. She didn't want to do it, but she went ahead and did it. Turned out she had microscopic calcifications that went to the pathological lab, and they were precancerous. All of this was removed with an outpatient procedure, and imaging was done, and they told her because she got that mammogram, her life was saved, because she would have had cancer that would have potentially grown and spread, and she could have lost her life.
And I guess it's just easy to do. You call your doctor and say, hey, I'd like to come in for a checkup.
Most definitely. Everybody needs to get that physical exam every year, because it could be the difference between life and death. And if you don't do it for yourself, do it for your family, because you deserve it.